someone you love starts to lose their vision, it can be, well, it can be really overwhelming. We're going to talk about something called low vision care. It's a whole field that's all about helping you use the sight you have to live your life to the fullest. We're going to get into the practical steps you can take right now. Does any of this sound familiar? Squinting at a prescription bottle, trying to figure out the dose, or not being able to quite see the smile on your grandchild's face? Look, these aren't just little annoyances. They're real-life challenges that a standard eye chart, it just can't measure that stuff. It's about how vision loss can throw up all these frustrating roadblocks in your day-to-day life. Like maybe you find yourself bumping into the coffee table more, or tripping on a curb you just didn't see. And it's not you being clumsy. It's a real mobility issue that can start to make you feel a little unsafe, even in your own home.
Or how about driving? You might technically, pass the vision test, but you're still white-knuckling it because you're struggling to read road signs until the last second. That is incredibly stressful.
And we have to talk about the emotional side of things too. It is completely 100% normal to feel anxious or even a little depressed when your vision starts holding you back. That's a huge part of this whole experience, and it's something that low vision care can actually help with. Low vision. So here's the official definition. Basically, low vision is a vision problem that can't be fixed with your typical glasses, contacts, or even with surgery. It's the vision you're working with after your regular eye doctor has done everything they can for the underlying condition. So many people think you have to be legally blind to get any kind of help, but that's just not true. The reality is, low vision covers all sorts of things, like being really sensitive to glare, losing your peripheral vision, or having trouble telling the difference between similar colors. And you can have all that even if your vision on the eye chart is technically pretty good. Forget the numbers on the eye chart. It doesn't matter if you're 20/70 or 2200. What matters is how your vision is impacting your world and your ability to do the things you want to do. So if you're struggling to read the newspaper, if you're tripping on stairs, if you're feeling a little nervous just walking around, or you can't quite make out faces anymore, these are the signs. These are the clues that tell you it's time to have that conversation with your doctor. So let's just pull back the curtain and show you exactly what happens. It's really a pretty straightforward 3-step plan. First, they'll do some special tests to figure out exactly what your remaining vision looks like, to find the sweet spots. Second, and this is the most important part, they're going to talk to you about your goals. What do you want to do again? And then third, connecting you with the right tools and strategies to get you there. To get the absolute most out of that appointment, come prepared. Don't just talk about wanting to read. Bring the book. Bring your sewing project or the sheet music or that confusing bill you can't make out. When you bring the actual problem, it helps them find the perfect, specific solution for you. See, low vision care isn't about what's gone. It's about making the absolute most of the vision you have right now. It's about finding the right tools to build a fuller, more independent life. Think about it. When you have a knee injury, you go to physical therapy to learn how to use your body effectively again. Well, low vision care is exactly that. It's physical therapy for your eyesight. It's not a cure, it's a strategy. We're talking everything from special high-powered glasses to tiny telescopes for seeing things far away, to cool electronic magnifiers and even apps on your phone. But it goes beyond gadgets. It's also training and practical advice, like how to change the lighting in your house to make a world of difference. What's your path forward from here? Because this is all about empowering you, or the person you're caring for, to take back control and start finding some real solutions. First, ask for help early, based on how you're functioning, not some number. Second, the goal is always to maximize the vision you have. This care works with your regular eye doctor, not instead of them. And most importantly, reaching out for this kind of help is not giving up. It's the exact opposite. It's opening the door to hope and to solutions that actually work. What is that one thing? That one thing your vision is keeping you from, that you would just love to be able to do again?
My name is Dr. Sal Jivraj, and I am a low vision and a neuro-optometrist based in Calgary, Alberta. I'm excited to talk to you today about low vision and some options we have for patients who would like to see better for distance, intermediate and at reading. At our practice, we have a lot of the advanced low vision options, such as bioptics for distance and reading. We have the side awareness glasses. We also have the e-scoop glasses, which can be very beneficial for patients who are looking to drive. So I'd be happy to see you at our locations in Calgary. Again, I'm Dr. Sal Jivraj, a low vision and a neuro-optometrist, and I look forward to hearing from you if you would like to get help with your low vision. Thank you and have a good day.